My slide.
Yes, ma'am.
Okay.
Yes, ma'am.
So we will be discussing about diabetes insipidus. Review of anatomy and physiology of pituitary gland. We have two lobes, that is the anterior pituitary lobe and the posterior pituitary lobe. And today we will be discussing about this hormone, vasopressin, which is produced by the posterior pituitary. So diabetes insipidus, or the, DI, is failure of the body to conserve water due to deficiency of antidiuretic hormone, decreased renal sensitivity to antidiuretic hormone, or suppression of antidiuretic hormone secondary to excessive ingestion of fluids. That is primary polydipsia. What happened in diabetes insipidus is that the pituitary gland may not produce enough antidiuretic hormone. Okay, I forgot to tell you that the function of antidiuretic hormone is to reabsorb sodium and water in the body. Okay, so in diabetes insipidus, what happened is the pituitary gland does not produce enough antidiuretic hormone, or if the pituitary gland produce this antidiuretic hormone, there is decreased renal sensitivity to antidiuretic hormone. Means the kidney is not utilizing this antidiuretic hormone produced by the pituitary gland, or there may be suppression of antidiuretic hormone. When does this antidiuretic hormone get suppressed is when a person take too much of fluid, then the antidiuretic hormone will get suppressed. Polydipsia means excessive thirst. Next, types of diabetic insipidus. So diabetic insipidus is of three types. The first one is central or the neurogenic diabetes insipidus. This results from an interference with the antidiuretic hormone synthesis, transport, and release. So here, mainly the main defect is in the pituitary gland. If the pituitary gland is not producing enough antidiuretic hormone, and if it is not transported to the kidney to utilize by the kidney, that time the central diabetes insipidus occur. And these examples are causes of neurogenic DI. These are brain tumor, head injury, brain surgery, or the central nervous system infection. Means any condition that that is related to the brain, that damage the brain and the pituitary gland. And nephrogenic DI. The term nephro here refers to
Ma'am, your
kidney.
voice is breaking, ma'am.
My voice is breaking.
Yes, ma'am.
Okay.
Ma'am, can you please repeat neurogenic one?
Neurogenic. In neurogenic, the problem is with the pituitary. Okay. Pituitary gland means gland is the gland which produces the antidiuretic hormone. So what happened here is as a result of brain tumor or any head injury, the pituitary gland got damaged and there will be no enough synthesis of antidiuretic hormone. And as I have already told, like the function of antidiuretic hormone is to reabsorb the water and sodium in the body. Okay. But in this case, there will be no reabsorption, so the patient will be having polyuria. Polyuria means, poly means, you know now, excessive urination.
Urine.
Okay. So is it clear, central DI?
Yes. Yes, ma'am.
Okay, then I'll proceed with nephrogenic DI. So the term nephro means knee, okay. So nephrogenic DI, sent to the knee. When the pituitary gland produces antidiuretic hormone, it will go to the kidney and where the function of diuretic hormone will start. But here what happens is the pituitary gland produce the antidiuretic hormone, but the kidney is not utilizing those antidiuretic hormone, so there will be no reabsorption of sodium and water in the body. And examples include drug therapy, especially lithium, renal damage, and hereditary renal disease. So this lithium is a mood stabilizer, okay, mood stabilizer, mostly used for psychiatric patients. And any factor causes damage to the kidney and lead to nephrogenic diabetes insipidus. And the last one is primary diabetes insipidus. This results when a person takes excessive water. An example is structural lesion in thirst center and psychologic disorder. When these conditions are present and if a person takes excessive water, that can result in primary diabetes insipidus. This is a pathophysiology. Decreased antidiuretic hormone. If there is less antidiuretic hormone, there will be decreased water reabsorption in renal tubules and decreased intravascular fluid volume. Means when urinate in excess, that is excessive urination, then there will be less water in the intravascular space. That is decreased intravascular fluid volume and excessive urine output. And the patient might have dehydration. Clinical manifestation: polydipsia, polyuria. A diabetic patient can pass urine 2 to 20 liters per day. The normal person, around 1200 to 200 ml of urine we pass in a day, whereas a diabetic insipidus pass urine 2 to 20 liters per day. So what will happen with this is, if too much of water is lost from the body, then the patient may develop severe dehydration. Low urine specific gravity less than 1.005 and urine osmolality of less than 100 millimole per kg. So the normal urine specific gravity is 1.005 to 1.010. Okay, so less urine specific gravity means it is more diluted, and urine osmolality of less than 100 millimole per kg. Osmolality means the concentration. Okay, and serum osmolality is elevated, usually greater than 295 millimole per kg, and because of hypernatremia caused by pure water loss in the kidneys. So osmolality means concentration, and our normal serum osmolality is 295 millimole per kg. In a patient with diabetes insipidus, hypernatremia, because after passing the urine, all the sodium, hyper means high, and natremia meaning sodium. So the patient will have high sodium, cause pure water loss in the kidney. As you all know, the composition of urine is mostly water. So if more water is removed from the body, the sodium will remain in the body, and it will cause a high serum osmolality, that is more than 295 millimole per kg. And fatigue from nocturia. What is the meaning of nocturia? Anybody? Meaning of nocturia. Anyone, you tell me the meaning of nocturia.
To like when a patient has to urinate frequently.
Anyone who else know this nocturia?
Ma'am, frequent urinating during the night time.
Okay, so now you are right. Nocturia means if the word this noc is there, remember that it means night, okay? And urea means urine. So passing urine at night. Night usually we sleep, but if a person keeps on urinating at night, that will disturb the sleep and cause fatigue. And diagnostic evaluation. First one is urine specific gravity, sodium, and osmolality. So all this will be decreased in a patient with diabetes insipidus. And then serum osmolality and sodium are elevated. Any one of you know the normal sodium level in our body? Anyone?
Ma'am, ma'am, I don't know exactly, but then it is supposed to be till 145 or.
Okay, so the normal serum sodium is 135 to 145 millimole. So that is the normal, but in a patient with diabetes insipidus, it will be more than 145 millimole. And serum measurement of antidiuretic hormone is low in conjunction with high plasma osmolality. And water deprivation test. Uh, Water deprivation test means here the patient will be asked to restrict fluid. Means he or she will not be allowed to take any fluid for 12 to 14 hours. So normally us, like if we don't take enough water, then our urine output will be less. But what happened in a diabetes insipidus patient is that even if they are deprived of water for 12 to 14 hours also, still their urine, they will have polyuria. So and then this water deprivation test can also differentiate between this central and nephrogenic diabetes insipidus. So if there is no changes in the urine output of the person, means if the person is having polyuria despite of restricted fluid, then uh, this vasopressin will be given, and after giving vasopressin, again they will check the urine output. And in a with central DI, the after giving the vasopressin, their urine osmolality will come up to 800 milliosmol per kg, whereas in a patient with the nephrogenic DI, the serum osmolality will be less than 300 milliosmol per kg. An MRI of hypothalamic pituitary region. This is to find out if there is any injury to the brain, the pituitary gland, if there is any lesion, tumor. To find out all those things, MRI is required. See, okay, water deprivation test. Okay, here I'm writing 4 to 8 hours. Okay, this is the minimum hours, but it can take up to 12 to 14 hours. And let's come to the management. For central DI, fluids are replaced orally or IV depending on the patient condition and ability to drink copious amount of fluid. So if the patient can take orally, then we can encourage the patient to take more fluids orally. But in case if the patient cannot take orally, then we have to give intravenous fluid. And intravenous hypotonic saline. Hypotonic saline means your 0.5% normal saline or dextrose 5% in water. That is your DNS. So those are the hypotonic saline, means the osmolarity is less than that of your blood. And then DDAVP. This is the brand name for desmopressin acetate. And desmopressin acetate is an analog of antidiuretic hormone, and this hormone is the hormone replacement of choice for diabetes insipidus patient. Nephrogenic DI. Dietary measures like low sodium and thiazide diuretics like hydrochlorothiazide, which may reduce flow to the antidiuretic hormone, and this will increase the sensitivity in the distal nephron. Complications include dehydration due to polyuria and hypernatremia due to excessive water loss. And nursing assessment. In nursing assessment, what we do is to obtain this subjective and objective data. So here you have to obtain a thorough history of symptoms and behaviors of polyuria and polydipsia, and obtain history of fluid intake and output, and monitor pulse, BP, level of consciousness, fluid intake, output, urine specific gravity, and evaluate height and weight for weight loss related to possible decrease in calories due to excessive drinking, which causes appetite. Means if a person takes more fluid, then there will be no space for other food. So, but our body requires certain nutrients. But in this condition, the body will not enough nutrients, so weight loss will be there. So you have to assess for weight loss. Nursing diagnosis. Nursing diagnosis means clinical judgment about the patient or the family or the community, like how do they respond to the actual or the potential problem. And for formulating nursing diagnosis, as you have already learned in your first year BSc, like diagnosis we have to formulate after finding out the data, we have to prioritize the problem. And nursing diagnosis should always be formulated according to the priority, and the most prior ones should come first. So for patient with diabetes insipidus, deficient fluid volume related to disease process, this is the most priority nursing diagnosis. And for this, the goal is regaining fluid balance. Interventions include you have to monitor intake and output strictly, like every hourly, and assess for dehydration. The sign of dehydration like dry mucous membrane, increased pulse, weight loss, fever, and poor skin turgor. And administer IV fluid as ordered if acutely dehydrated. And the next nursing diagnosis is imbalanced nutrition less than body requirement due to fluid preference over food. For this, the goal is maintaining adequate nutrition, and interventions are provide liquid nutritional supplement. So when you provide liquid nutritional supplement, the person will not feel like taking more water, and monitor the height and weight and consult with dietitian to give adequate nutrients to the patient. The third one is disturbed sleep pattern related to nocturia and enuresis. Goal is normalizing sleep pattern, and interventions include ensure adequate evening administration of your desmopressin acetate to prevent nighttime water craving and enuresis, and provide easy access to fluid and toilet or commode. So do you have any doubts? Any doubts?
Ma'am, can you repeat this DDAVP?
DDAVP, this is actually a brand name, okay? Okay, I'm